The ICU, a place of intense care where every second counts. Here, the stakes are incredibly high and the pressure is relentless. As healthcare professionals, we make countless decisions every shift. It can feel overwhelming. Each choice can mean the difference between life and death. That's where the power of a checklist comes in. It acts as our guide, ensuring we stay on track. Think of it like a pilot's pre-flight checklist. Just as pilots ensure every detail is checked before takeoff, we ensure every aspect of patient care is covered. It ensures we don't miss crucial steps. Every tick on the list is a step towards better care. One such checklist is Fast HUGS in BID. This mnemonic is a lifesaver in the truest sense. This mnemonic helps us remember essential elements of ICU care. It's a simple yet powerful tool. Let's break it down, letter by letter. Each component is vital for patient survival and recovery. This isn't just a random list of tasks, it's a roadmap to better patient outcomes. It guides us through the complexities of ICU care. By following Fast HUGS in BID, we provide comprehensive care, reduce complications, and ultimately save lives. It's a systematic approach that makes a real difference. So let's dive in and explore each component in detail. Understanding each part will help us deliver the best possible care to our patients. Imagine trying to run a marathon without any food. Impossible, right? The same goes for our patients in the ICU. Their bodies are working overtime to heal and they need proper nutrition to do so. F in Fast HUGS in BID stands for feeding. We assess each patient's nutritional needs and determine the best way to provide them with the calories and nutrients they need. This might involve intravenous feeding, tube feeding, or if possible, a gradual return to oral intake. Remember, adequate nutrition is the foundation for healing and recovery. Pain is more than just discomfort. It can hinder healing, increase stress, and delay recovery. That's why A in our mnemonic stands for analgesia, which simply means pain management. We use a variety of methods to manage pain, including medications, nerve blocks, and non-pharmacological approaches like repositioning and massage. The key is to individualize pain management for each patient. We want to ensure our patients are comfortable, which promotes healing and improves their overall well-being. While pain relief is crucial, excessive sedation can be detrimental. It can prolong mechanical ventilation, increase the risk of delirium, and delay rehabilitation. S in Fast HUGS in BID reminds us to find the right balance of sedation. We use validated tools to assess sedation levels and adjust medications accordingly. The goal is to keep patients comfortable enough to tolerate necessary procedures while minimizing the potential side effects of sedation. T is for Thromboembolic Prevention, keeping blood flowing. Critically ill patients are at increased risk of developing blood clots, also known as deep vein thrombosis or DVT, and pulmonary embolism or PE. T in our mnemonic stands for Thromboembolic Prevention. We use a combination of mechanical and pharmacological methods to prevent clot formation. These might include compression stockings, sequential compression devices, and blood thinners. By preventing blood clots, we reduce the risk of serious complications and improve patient outcomes. H is for head of bed elevation, a simple step for big impact. Might seem like a small detail, but elevating the head of the bed can make a big difference in preventing ventilator-associated pneumonia or VAP. H in Fast HUGS in BID reminds us to keep the head of the bed elevated at least 30 degrees. This simple intervention helps prevent oral secretions from pooling in the back of the throat, reducing the risk of aspiration and subsequent pneumonia. U is for Ulcer Prevention, protecting fragile skin. Critically ill patients are vulnerable to developing pressure ulcers, also known as bed sores. These painful wounds can develop quickly and lead to serious complications. U in our mnemonic stands for ulcer prevention. We take a proactive approach to protect our patients' skin. This includes regular repositioning using specialized mattresses and cushions and keeping the skin clean and dry. G is for Glycemic Control, balancing sugar for healing. Just like Goldilocks and the Three Bears, we need to find the just right balance for blood sugar levels in our ICU patients. G in fast HUGS in BID stands for Glycemic Control. We closely monitor blood glucose levels and administer insulin as needed to maintain a target range. Keeping blood sugar levels stable promotes healing, reduces the risk of infection, and improves overall outcomes. S is for spontaneous breathing trial, the road to recovery. For patients on mechanical ventilation, our ultimate goal is to liberate them from the ventilator as soon as it is safe to do so. S in fast HUGS in BID stands for spontaneous breathing trial, or SBT. We assess patients' readiness for SBTs and conduct them regularly. This allows us to determine their ability to breathe on their own and progress them towards extubation when appropriate. I for infection prevention, the first line of defense. The ICU environment, while technologically advanced, can also harbor potential pathogens. Preventing infection is paramount to ensuring optimal patient outcomes. I in fast HUGS in BID stands as a constant reminder of the importance of infection prevention. This includes meticulous hand hygiene, strict adherence to sterile techniques, and prudent use of antibiotics. By minimizing the risk of hospital-acquired infections, we can significantly improve patient safety and recovery. N for nutrition assessment, adapting to changing needs. A patient's nutritional needs can fluctuate throughout their ICU stay. What worked yesterday might not be sufficient today. N in fast HUGS in BID emphasizes the continuous need for nutrition assessment. We regularly evaluate patients' caloric requirements, protein needs, and electrolyte balance. This allows us to adjust their nutritional plan accordingly, ensuring they receive the optimal support for their changing needs. B for bowel care, a sign of recovery. While it might seem like a less glamorous aspect of care, bowel function is a crucial indicator of a patient's overall health and recovery. B in our mnemonic reminds us to pay attention to bowel care. We monitor bowel movements, assess for constipation or diarrhea, and intervene as needed. Regular bowel function is a positive sign of gut health and can contribute to a smoother recovery process. I4, invasive lines and devices, minimizing risks, maximizing comfort. In the ICU, patients often require various invasive lines and devices, such as catheters, central lines, and feeding tubes. These devices are crucial for delivering medications, nutrients, and monitoring vital signs. While these are essential for treatment, they also come with inherent risks. Infections, blockages, and other complications can arise if not managed properly. The second I, in fast HUGS in BID, emphasizes the importance of managing these invasive lines and devices. Proper management involves a multidisciplinary approach. We perform daily checks for signs of infection or complications, ensuring that any issues are caught early and addressed promptly. We ensure proper placement and function of these devices, verifying that they are correctly positioned and functioning as intended, and remove them as soon as they are no longer needed. This reduces the patient's exposure to potential risks. By minimizing the duration of invasive interventions, we reduce the risk of complications and improve patient comfort. This approach not only enhances patient safety, but also contributes to a quicker recovery and better overall outcomes. D for de-escalation, the art of stepping back. In the ICU, we often start with aggressive interventions to stabilize critically ill patients. However, as patients improve, it's crucial to de-escalate these interventions to prevent complications and promote recovery. D in fast HUGS in BID stands for de-escalation. We continuously evaluate the need for ongoing medications, therapies, and interventions. As patients recover, we gradually reduce or discontinue unnecessary interventions, promoting a smoother transition to lower levels of care and, ultimately, a return to normalcy. Fast HUGS in BID, a holistic approach to critical care. Fast HUGS in BID is more than just a checklist. It's a philosophy of care that encompasses every aspect of patient well-being. It reminds us to treat the whole patient, not just their illness. This approach ensures that we consider the emotional, psychological, and social needs of our patients alongside their physical health. By addressing pain, nutrition, mobility, and infection prevention, we create an environment that promotes healing and recovery. Each element of fast HUGS in BID is crucial in maintaining the delicate balance required for patient recovery. This mnemonic serves as a guide, but it's our clinical judgment, compassion, and dedication that truly make a difference in the lives of our patients. Our ability to adapt and respond to each unique situation is what sets us apart. Let's continue to embrace a holistic approach to critical care, ensuring that every patient receives the best possible care and the best possible chance for a full recovery. Together, we can make a significant impact on the lives of those we serve, fostering a culture of empathy and excellence in critical care.